Yes, thank you for coming, Sir Laurent. Thank you very much. What are your observations regarding the frequent and often incorrect use of cardiac meditation in cats and dogs?
Okay. So ideally, as in human medicine and veterinary medicine as well, ideally we have to have a diagnosis to make sure that we prescribe and start and tweak the right medication. So for dogs, for example, what I often see is that diuretics have been given or are being given to coughing dogs. But first of all, that's already a big misconception that people think that congestive heart failure is characterized by coughing, which we know in the vast majority of cases is really not true, especially if it's not correlated with dyspnea and tachypnea. So therefore, you have to be very cautious with giving diuretics in patients if you don't have the confirmation that there is congestive heart failure. And then in cats, for example, the incorrect use of clopidogrel or rivaroxaban, if the left atrium is not enlarged, can be quite dangerous as well.
Dangerous as well, yeah. Why is blood pressure monitoring and accurate measurement so critical in small animals?
Yeah, so the measurement of blood pressure is extremely important because we know that both low and high blood pressure can have a very bad impact on your body in general, both in people and in animals. And for example, in cats, it can lead, or an increased pressure can lead to HCM, which is a thickening of the heart muscle. And then, for example, in dogs, it could worsen the degree of mitral valve regurgitation. So therefore, addressing an abnormal blood pressure is very important, not only for the heart, but for other organs, for example, the eyes, the kidneys, and the brain as well.
Yeah. In your opinion, is there an increasing trend to cardiac disease among cats and dogs? If so, what are the underlying causes?
So I think we're approaching a very interesting area in general in veterinary medicine with, for example, AI coming into the picture. And I think we will only have more increased information about diagnosis and appropriate treatment. So don't think that the prevalence necessarily might change, but we might increase our ability to detect certain diseases more early and to tweak our medication accordingly and management accordingly.
Could you share your evaluation of the TuVECCA Congress? What do you think?
Yeah, to be honest, it's amazing so far. The hospitality has been second to none. Everybody knows me longer for an hour knows how much I appreciate good food, and the food has been tremendously here. And the warmth of the audience and the respect has been very eye-opening as well. And yesterday during the opening ceremony, I was very surprised to learn that the next edition will focus on AI, because I have been very interested in AI for a while, and we actually have launched a product just a couple of months ago on AI and heart murmur detection and heart rate variability through cell phones, so smartphones. So I can't wait to see what other people are working on as well, because I think AI can be a tremendous additional and complementary tool to what we have already today.
Why important AI? What is next?
So AI, I think it will reshape everything that we're doing, ranging from screening, diagnosis, monitoring, patient communication, how we do consultations. So for example, you have programs already that help you during the consultation. We have enhanced AI interpretation of images. We have studies showing that AI retrospectively can actually detect certain diseases more early than vets can do. I'm sure that, or my suspicion is that AI won't replace vets, because you can't replace, as far as I can tell, a gut feeling or experience to a certain extent, although AI needs to be trained. But for example, to give you 20 seconds on what we have been developing. So given the global situation and the macroeconomic situation of the whole world, not everybody can afford certain tests anymore. We have to be honest about that. And for example, whilst, 24-hour Holter monitoring, which is a vest to detect heart rhythm disturbances and rate for 24 hours, will still remain the golden standard for a while, what we developed is a solution for people that don't have access to a Holter or cannot afford it. So you hold your cell phone against your chest. You hold your cell phone against the chest of the dog. We have developed it for people, and we're on progress to do it for cats and horses as well. And it is recorded. It is analyzed by AI. You get the results on the presence of a heart murmur, the heart rate variability, the presence of an arrhythmia. There's a report generated and then fact-checked by a boarded specialist in veterinary cardiology, and that report is then being sent to the vet and the owner. So you get a very detailed report that is checked by a specialist within 24 hours.
My question, a special question: pet owners for veterinarian, AI veterinarian or clinic veterinarian, pet owners, what do you think?
So your question is whether pet owners do a lot of research themselves with AI. Yeah, so it's an interesting trend because everybody thinks that, for example, ChatGPT will replace vets. But if you think about it, okay, you can have AI surpassing you in the interpretation of images. But for example, being a cardiologist, I can't see AI being replacing me taking the images, acquiring the images, because that's very angle dependent and operator dependent in general, replacing me. But, and even if it partially replaced me with the interpretation, that would mean that I guess the costs will drop of a vet because you have more you have more to offer. You can see more cases per day. And on the other hand, I don't want to sound too romantic, but I started my job to help as many patients as possible. So if I have a complementary tool that can benefit the well-being of my patients, I think we should really be open to embrace that type of technology.
Thank you.
No, it's my pleasure.
All right, thank you very much.
Lovely.
Thank you for coming.
That's okay,
Thank you.
don't worry.